ClinHaem Haematology Demystified.
So welcome back. This is Husnain, one of the hematologists working in the UK, and this video is about the FRCPath Masterclass Series that we plan to run from September 2025 to February 2026 to try to target the spring 2026 FRCPath Part 1 exam. I've just done a session online with some of the colleagues who have registered for interest, but this video is for those who couldn't attend. Now, just a bit of an intro into the FRCPath exam itself. If you are applying for it, then this means you are quite, advanced in your careers. You've come this far, and this exam is actually easier than you think. You've done much more difficult exams in the past. So MRCP being one of the most difficult exams, for example, because it's got 3 parts. The syllabus is all, the curriculum is all over the place, and you don't really know what to cover and what not to cover. But with this exam, you are doing that while living in this same specialty. So it's the same specialty that you live in, and if you want to learn about it, that's not difficult. And the pros of the exam are that it actually benefits a patient care directly, and it makes you confident at your job, which is another plus point. Helps with patient care, and this exam helps you grow in your career. Of course, it's a mandatory requirement towards your training, but it also is a very well recognized exam internationally, and it's a very good thing to add to your CV in hematology. So the first thing when you're thinking about preparing for exam is you and I actually need to know, why do we need to know anything as medics? And this is why.
Oh no! Oh no!
So these few seconds of the video cover really nicely why we need to know anything, because literally somebody's life depends on it. And of course, you do not have to panic because you do not work in isolation. You've got other team members and colleagues, seniors, that you can ask help from, and other team members as well. But regardless of whatever your grade is, if you're a medical trainee or a hematology trainee or even a consultant, the fact of the matter is that people's life does depend on what we know and what we do. So that's why we have to be really serious about it, which we really are. That's one of the reasons that you are here on the course watching this video. Now, jumping directly into the preparation tips, there are some journal tips which I'm pretty sure you guys are already aware of, but sometimes they just need spelling out so that you can set the tone right. And the most important of them all for this exam is that you learn on the job, which you are already doing actively or passively. Maybe most of us are more passive about it, but we do not need to be a bit more active about it. So if you see a case, you're discussing with somebody senior, etc. But you should also, if you have time, or at least at the end of the day, go through the BSH guideline, for example, on the topic itself. And this will consolidate your memory quite nicely, because nothing else will help you in exam or in real life than how your experience has been. And if you see a particular case, you go through the guideline, this will consolidate that in your memory, and this will really help you with your exam more than the courses that you attend, or more than the revision that we do, because this has got multiple layers to help that consolidate in your memory. And this is something that really helped me in the exam quite a bit, as well as it hopefully does everybody. But the problem is that there are, fortunately or unfortunately, there would be some things that are possible to be part of an exam question, but they are so rare that you would possibly not see them in real life. That's why, even though learning on the job is really, really important, mostly that on its own is not sufficient for passing the exam. And you do need to do some reading as well, and that's where hopefully I will help you guide through the curriculum, which I will come to, so that we don't miss anything essential. And this is the most important, factor that will keep you going, is the motivation to learn about hematology. For the exam, you need to be quite motivated, but doesn't mean that you do, revision all the time, morning to evening. But if you change your mindset a bit, if you're working on the job 9 to 5, and then you're thinking, I'm going to refer to the guidelines. So this is actually subconsciously preparing you towards the exam and becoming a better clinician in general anyway. But for the revision, exercises that, for example, we are doing, you do need a bit of motivation. So maybe an hour a week for the sessions and some reading time for the topics that we are going to discuss in that week. So a little bit of persistence is key. And you do need to enjoy heme. It's quite a nice specialty. And as you know, most people outside of hematology wouldn't have as much experience of hematology, and sometimes it's quite niche. So even the most simplest of things may be described by other colleagues as, oh, complex quote unquote hematology problems, and this way you need to enjoy. There is something that you do that you can help other people with, and the feeling of helping somebody else, even if it's another colleague and definitely a patient, is what's very rewarding. Some other tips that are exam related specifically, again, I'm sure you know them, but just to spell them out, you do not need to know the curriculum and the exam format, because that's some easy marks there, because you can tune your preparation accordingly. Because you need to, at the end of the day, take the exam as the examiners have planned it. So it's we do need to read the questions carefully, and some of us do fall into this trap. The question's asking about something else, and we've written paragraphs about something that's not asked or going to be marked in the question, even though that might be right. And this is very important to stay on the point. And if there is a question that has got multiple stems in it, you definitely need to read the full question to begin with before attempting even the first part. The reason is that some of the questions, especially in the long essays, they would flow. So there would be an illness, and that would flow towards, so there would be, for example, the first question might be what the diagnosis is from the clinical stem, then how would you manage it, and okay, this patient has now developed so and so complication, so what would you do? So the subsequent stems will actually give a hint to what the diagnosis was in the beginning. So for example, if there's a patient who's coming with pancytopenias, and they've given you bone marrow findings and this and that, and they say the diagnosis is aplastic anemia, they wouldn't, of course, spell it out, and they will ask you to give them the differential diagnosis and how you would manage it. But then the third stem or the fourth stem might be, okay, the patient's now suddenly developing frank hemolysis and frank hemolysis and red color urine, reddish pink urine and things like that. So what's happened? So they've started to develop perhaps PNH now. So that's why you could link it back to say, okay, this was likely aplastic anemia that they had, and now they're developing into frank PNH. So this will help you correlate. And similarly, say there's another stem, a patient they've given you a scenario which is myeloma. In the first question, they would say, what's the diagnosis? How would you manage? And in subsequent stems, they might say, okay, they've had some chemotherapy or whatever, but it's not responded. And unfortunately now they have become poorly again, and the peripheral blood now shows plasma cells of so many percentage. So what they've done is they've given you the fact that this patient has now gone into plasma cell leukemia. So probably initially it was myeloma to begin with, and now it's gone to plasma cell leukemia. So you can, basically guess what the answer is. And this is, quite easy marks. And some people, unfortunately, have done this mistake that they would start attempting the part one, not reading the stems at third and the fourth stem, and then after wasting so many minutes realizing, oh my god, this is asking about totally something else, and I've been wasting time. So so read the question carefully, stay to the point. Now, practice. So exam is 50-50. So 50% preparation and 50% time management. And you will definitely feel time pressure in the exam. You will have lots of things to say for the questions, and you will find there's not enough minutes there or seconds there to answer them. Some questions you will know very well, others you wouldn't know very well. So those that you don't know very well, just if you are attempting them, just attempt whatever you know quickly. do not waste more time thinking or making things up, etc., just to fill the space. Move on to the next question. Answer the ones that better, and then come back to these the ones that you don't know. Maybe something comes back, but do not waste your time on a question that you don't know absolutely everything about. Just write what you know, move on, and then you can come back. And this is something that many people don't know. Apply for reasonable adjustments early. Now, the college is really, really supportive for, in lots of different ways. And they will send you an email to us, once you register for the exam, to say if you have to apply for any reasonable adjustments, please do so. And you would be surprised at how helpful they are. So many people would ask for, say, if they have eye problems and things, so they will mention that. And the college will give you, say, extra time to attempt the exam. And say in part 2, for example, so part 1's on online, so it would be on usually done on so of course online on a laptop, etc. But part 2, for example, is written, and some people who have got horrible handwriting or they just can't write, so they would ask the college and they would say, okay, for you, you can do it on a laptop, and they've done it on a laptop on exam online. So you need to see where you think you might need some help with, and it's very good to spell it out and ask the college to say, can you help me with this? And because they've had so many colleagues or candidates previously, they will definitely help you with whatever they can. And lastly, this is the most common misconception that people have, and you do need to from day one, you need to know you're not just preparing for part 1 exam. This is what I was told as well, that okay, you're preparing for part 1 and then ultimately you're preparing for part 2. It's the same curriculum, it's the same syllabus, it's the same topics, it's the same hematology. So when you're preparing for part 1, you are actually preparing for part 2 as well. Just morphology is the only thing, and it's going to be added perhaps. And then it's this, once you're preparing for any topics, for example, CML, you go through a guideline or whatever, you're making, some people make their own notes, you're making your own notes. You don't make your notes to say, okay, this is just for part 1. You're making it a nice and tidy and uploading it on your Dropbox so that you can refer to the same thing in part 2. And the same knowledge is going to help you in part 2. So definitely you're preparing for both the exams at the same time, and this course will help. That's why I say with this course, you will have hopefully have a strong foundation for part 2 as well. Now, at this point, a colleague asked me a question when I was doing the live session, that when can you apply for part 1? So on the Royal College website, they say generally you should have at least 12 months of experience in the specialty before attempting the exam. So ST4 sounds like a good idea. But another common question is when to attempt part 2. So once you've done part 1, these recommended strategies that you apply for part 2 the next attempt or the attempt afterwards, so within a year or so, because as you know, BSH publishes guidelines every month. So if you leave it long enough, you might have to do lots of things all over again. So the trick is to stay focused and just get through the difficult part in subsequent sessions. So part 1, and then next attempt or the attempt afterwards to part 2, and then you can hopefully park it there. Now, some methods to prepare for the exam. BSH my guidelines are a must, but unfortunately, most of them are written as if everybody is an expert in hematology. They do not touch on the basic concepts or the basic terminology. Some of them are really nice. They actually start from the basics, explain what the terminology and the concepts are, and then build upwards. But most of them, frankly, aren't. So you do need to know and this helps your memory as well. If you know why they've suggested this, what's the rationale behind this. So that's where some other things will come into, which we will go through in the course, depending on what topic we are doing. So like textbooks, and there are online resources like lectures and podcasts, and the sessions that we will do, of course, as well. And I will link them depending on what topic we're discussing as we go along. Some people are in the MCQ only world. Now, I am not really a fan of just doing MCQs for quite a few reasons. So when I was preparing for part 1, there were, of course, lots of MCQ banks, some of them very expensive. But what I noticed was that some of them, just to create a MCQ bank, they would fill their bank with all sorts of MCQs which are not of the best quality, seriously, and they would just be, some of them are frankly wrong. The answers are outdated. So that's why I was like, I don't think I'm getting a lot from there. So I would rather prepare a topic, and then if I have free time and free money, then I would maybe buy a bank and then go through them. And I didn't do a lot of MCQ banks for that reason. I focused mainly, and I'll show you how I prepared for that in a bit as well. But they do have their place. Some people are they know the topic, they just want to test how they are doing. So that's fine. You can go through the MCQs, but be careful because some of the questions might, the answers and the explanation might actually be wrong as well. So you need to see which sources you trust and use only them. And revision courses are again good, but they are not a be all and end all. They are just going to sharpen your skills at the end of what you already know. And there are some courses that I went to, and I would mention that in our WhatsApp group for the exam prep that we have, which I found useful and which I did not frankly find useful at all. So some of them were not useful, and so we are, of course, we got the money refunded. But again, especially if you're not getting the money back, then are they really worth it? Textbooks is another important question, and back outside of the UK, they are quite in fashion, but it's not practical to do guidelines, of which there are 123 at the moment, and textbooks at the same time, because there's a lot of material. But you do need to know which topics to perhaps go through the textbook so that you get a good concept of, and that's where I would hopefully help you in selecting the topics as we go on the weekly sessions. Now, the good news is that the two most common books that are used for hematology are called Hofbrand's Postgraduate Hematology and Hofbrand's Essentials. And both of them have had recent editions published in the last few months to a year, which is good because they're quite up to date. And if you're working in the UK, most of the libraries would have access to them. So do make use of them. Just drop your library an email and ask them to grant you a copy online or offline of these books. And if you're in where I work in the region, and I've actually asked them, and they have copies for both of them, or they can get it for you. So that's very important to keep them as a resource. There are lots of other resources, and I do not want to overwhelm you. There are lots of podcasts, videos, lectures, or etc. And this is where I would help you link them where and as you need to know throughout the the preparation months. And I would mention them in respect to that particular topic. Now, how I prepare for FRCPath Part 1, I'm not an MCQ only person, as I've said. What I did was I like to read the topics from topics basics from a book or an online resource first, and then I read the research guideline, made my own notes, and at the end I would just refer to those notes, and that would bring everything back like a great flashback, which is good. Some people really like that method. It helps you become a better clinician as well. But some others have got other learning methods that are of course, totally acceptable as well. But of course, I cannot do this for all the topics. So for less important topics, I would use quick resources like the brilliant heme base, for example. And I'm sure you know, if you don't know, Google that and bookmark that. You definitely need to know about heme base. It's really good. For things that I'm not sure about or they're not covered in the guidelines, I will use resources like UpToDate instead of a Google search, because Google search wastes a lot of time. Some of it is not accurate. UpToDate is one of the best platforms out there. Good news is that most of the libraries, even if they don't have subscription, so in the UK, many hospitals would have a paid subscription. So check with your library and get it downloaded in your app. You earn free CBT points as well. If they don't have UpToDate login, you can still check with your library. They will be able to help you with specific topics from UpToDate, and they will be easily, get it for you. So make use of that. Now, if you are outside of the UK, there are many schemes that give you UpToDate for free. And if you do let me know in the comments below, I can try to send you some links for that. So you just register that. So low and middle income countries, the UpToDate has got some plans for them, and you just have to prove that you're working there, and they will give you a free subscription for UpToDate, which is great. Now, I could have used AI as well to help with difficult concepts, and I use AI all the time now. But I don't think when I did part one, the AI was like a big thing then, or maybe I was just living in a bubble. But of course, we have to be careful. The AI will make lots of mistakes and it will say it out so confidently, you will be like, yeah, it must be right. But if you challenge AI, many times it will change its own statement many times in the same conversation. So, of course, they're not the gold standard at the moment, at least. And now, if you asked me what my score is, I can let you know. But to see if these things worked, but I would, of course, not spell that out here. Now, moving on to the curriculum, because you do need to know what you are going to be judged against or examined against, not judged against, sorry. We should not be very judgmental. You are going to be examined against is the curriculum as led on the FRCPath website. So before that, this is the the overall way the exam is going to be. So you have two papers, both written, of course. The first is essays and second is MCQ/EMQs, which is extended matched questions. Now, for both of them, both papers, each paper would have 25% weightage for all the four subspecialties. So the 25% of, say, for paper one, 25% is going to be from malignant heme, 25% from journal heme, including lab management, and 25% from transfusion, and 25% from hemostasis and thrombosis. And same for the MCQs, the EMQs as well. They will try to divide it equally between all the topics. Now, on EAMS, if you go to the website, Royal College of Pathology's Haematology exam website, and then click on the MCQ section, it will actually give you a breakdown of which MCQ topics which actually themes they are going to test you on, which is quite handy to know, so that you at least know what you're being tested in. And you don't need to, of course, know everything about that, and I will try to cover all of them in the preparation plan. This is, and what to exactly cover, what is the exact curriculum or the syllabus that they expect us to know, is actually the hematology training curriculum. Just Google it and this will come up, and this will actually inform you what you are being tested in, to see if you are confident in management of big scenarios related to these curriculum contents. But of course, some of the curriculum things will be vague. It's not very concrete, like what do I exactly need to read? So there are guidelines that you definitely need to read. Now, there are basic guidelines, of course, needless to say, are the most important. They're roughly 123 as of few days ago when I was looking into them. There must, and anything in the guideline can be asked about. Some are more important than others, depending on how important they are clinically and acutely for patient care, etc., for example. But the problem is that in the curriculum, there are things that BSH hasn't made a guideline about. For example, when I did my exam, there was nothing about CMML, for example. And the long essay that I had was on CMML, which is, I can't say, oh, how can you ask me about CMML? Because there's no BSH guideline about it, because it's in the curriculum and it's something that we all need to know about. So that's where I would help you try to cover everything that you need to know. And that's where I have made the plan that I will show you some screenshots of in the next few slides, so that we don't miss anything important in there. Now, this is the, so that's why I made this Masterclass series to cover is the curriculum, the BSH guidelines, and other core guidelines, because you need to know the BSH guidelines, but there are also topics that are covered in other guidelines, like the Royal College of OBS and Gynae OBS guide, Royal College of RCOG, Royal College of Gynae/OBS guidelines. And then there are some other guidelines related to ISTH, for example, thrombosis, that are not covered in BSH. And of course, as a ST3 or starting in hematology or for exam, this is the most important problem. We don't know where to find them. So I've done all of that for you, because I have done the exam and I've been doing hematology. So I know where to find what, and where to get them from, and what you need to know really, and what is just a passive read. That's why we will we have weekly sessions to focus on these. And even and you will get access to, of course, the WhatsApp group that we have made for those who have registered interest in the course, and you would have my email as well to ask me any questions about throughout the week, and I can help you with that. Now, so that's how we plan to cover all the important hematology topics that will be in the exam. Now, even if you're not planning the exam, so say you're like just starting hematology, this is still for you, because the most important thing to know is that you should start preparation for the exam on day one. You shouldn't say, oh, I'm an ST3 now, I will just see a few months down, or maybe 6 months after. Don't delay that. Just start doing slowly whatever you can, absorb it actively, passively. That's why this course is hopefully useful to everybody interested in hematology. Even if you are like a medical trainee going to start hematology ST3, or if just an ST3, and exam's not on your immediate list of priorities yet, but at least you become better at hematology. And there's no harm in learning something that will help you when you are actually sitting down and preparing for exam as well. And you shouldn't separate learning about heme, becoming a better clinician, from exam. And that's the main takeaway that I'm actually trying to deliver here. So how exactly we are going to do? We are going to do this online. Links will be sent in the dedicated WhatsApp group that we have made. Mostly will be Saturday 9 a.m. because that's when I got most flexibility from other commitments, etc. But sometimes if I'm on call or other commitments, it might be other days. For example, Sunday 9 a.m. These will be recorded, so you can have access to them afterwards if you are unable to attend. Now, I do request that you do try to attend these sessions, but of course, it's not possible. Exam is not the only thing in our life, of course. If you can't attend it, that's fine, but try your best to do so if you can. There is a way of sacrifice that's needed to achieve anything important, as you know, anyway. But yeah, if you can't manage to attend, recordings are there. Now coming to this overview of the planned structure. So weeks 1 to 7, general heme, then hemonc, then transfusion medicine, then hemostasis thrombosis. Order them this way because general heme is usually relatively easier things to remember. So even if you do it now, hopefully you will still remember them at the near the exam. Hemonc is something that you do all the time. Unfortunately, our training is more skewed towards hemonc, but as I've said, exam is not skewed towards hemonc. It covers, all the topics are given equal weightage in the exam. So this is actually an important thing to remember. Don't just focus on it. Some people would just become experts in hemonc, but they would ignore everything else. So you only got 25% of the curriculum sorted. You don't need to be an expert in one field for the exam. You need to know a little bit about everything as compared to everything about just a little bit, if that makes sense. So that's why I've not given more weightage to hemonc, even though the research guidelines are like 40% of them are around hemonc, because you have to give equal weightage to how they're going to judge us, examine us in the exam. I mean, I've said third transfusion medicine because closer to the exam again, and last is hemostasis and thrombosis because I feel the retention time for hemostasis and thrombosis things is actually the shortest. So hopefully you're doing it closer to the exam so that it's fresh in your memory. And finally will be a mock exam or session in week 26. And at the end of each theme or block, there would be a session for a practice session. And what I mean to say is that, so here is a screenshot for the journal heme schedule. The full schedule I've shared in the WhatsApp group. Once you register for interest, you'll have access to that. But this is the journal heme plan. So week 1 starts tomorrow. So 8th of September is week 1. And then these are the weeks and these are the topics. So after doing the topics that are important for the exam, we will have a revision schedule at the end of the block. So same goes for hemostasis, thrombosis, transfusion, etc. Now, the way I would like it to work is that So say, for example, the next session would be next Saturday, 9 a.m. on IHA and ITP, and I will prepare some content and presentation for that. But on every Monday or so, I will send you the resources that you need to learn or read and go through for that particular topic on a Saturday. And ideally, you can go through everything or you can pick and choose. Of course, that would include a link for the guidelines. So for example, for BSH guidelines for IHA and ITP, there are some consensus guidelines. But I will also send some podcast links that I know are very useful for exams. So for example, for IHA, I know there's a podcast done by one of the leading experts in IHA in BSH on blood education. So I'll send you that. And there is another video about pan-reactive antibodies and how to sort them out, especially in the context of IHA, for example. And I will send you that as well. So throughout the week, you'll hopefully go through them. And on Saturday, I'll present my session and that will consolidate your memory and we'll go through any questions, etc. And then the next cycle starts. Of course, meanwhile, if you have any questions, you will be sending them across to WhatsApp or on the email. And that's how we will hopefully cover everything that's there in the curriculum that's important for the exam. And that's the WhatsApp group that I'm talking about that we have active and running at the moment. And that is everything I wanted to say today. If you have any questions, let me know in the comments below. And if you want to register for the course, you just go to the link here at the bottom. And I will link that in the description somewhere as well. And that's the YouTube channel that you're watching this on. Thank you very much and have a good weekend. See you later.
Thank you for watching. Stay tuned for more.